Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Doll Simons Family Studio. Delighted to be back with you on this beautiful Tuesday morning. Wow, was yesterday gorgeous and is today shaping up to be the same. Speaking of cool things, we've got a great story to share today. Boy Scouts from Troop 320 in Liberty and Troop 180 in Gladstone earned merit badges during this pandemic by helping to distribute PPE to their communities. Our Scouts joining us today are Robert Reece and Jacob Caylor. Their merit badge counselor is Dan Reece, who is also a Clay County Emergency Preparedness Specialist. That's a big lot of words right there. And retired Air Force pilot. And Dan Neal, the Director of Operations at Heart to Heart International, who played an integral part in this success story. Dr. Dana Hawkinson, Hawkeye, is out today, and in his place, we welcome Amanda Cackler, Director of Safety and Quality here at the University of Kansas Health System. Welcome aboard, Amanda. I told her I was going to mess with her today. This is perfect. How do we do overnight with those numbers?
Okay, well, instead of telling you how we did overnight, I'm going to tell you how we did yesterday in the afternoon, because I had done a little drill down as requested by some of our community members.
Awesome.
So yesterday we had 14 active patients. We had 11 additional that were in that discontinuation phase. So we were at a total of 25 yesterday in the middle of the afternoon. Of those 14 active, 12 of them came in with COVID-like symptoms. 12 of them were unvaccinated and 2 of them were fully vaccinated. So just a little bit of information regarding our active patients yesterday. I know Hays has a couple of patients in their healthcare facility today. So I think our numbers are sort of staying in that full, we're in the 20s.
We're in the mid-20s. We have been in the mid-20s for a while now. On the people who were vaccinated, any sense of how sick they were?
Okay, so our 2 fully vaccinated patients yesterday, they came in symptomatic.
Okay.
They also, when you looked at their medical history, one of them had multiple chronic conditions, heart disease, lung disease, some history of cancer, and then our other patient is actively on chemotherapy. So some critically ill patients otherwise who also were fully vaccinated, I want to say in March and in April, but it's hard to know. I don't know where the COVID was it worsening their underlying disease or vice versa.
Right. So I think it's just important to say vaccines keep you safe, but they are not a get out of jail free card, meaning that you can still get sick. There's really good there. There's an article last week or the week before in the Annals of Internal Medicine, which is a very high quality medical journal, looking at the effectiveness of vaccination in transplant patients and demonstrating that. Now, we don't know about T-cell immunity. We talk a lot on this program about T-cell and B-cell immunity. T-cell immunity is really kind of blood-borne immunity outside of, and they're your T-cells that help you fight off infection, and the B-cells make the antibodies we talk about a lot. And that's what we measure in serum. So what we know is that transplant patients often don't get a good antibody response after vaccination, whether it's COVID or any other vaccine. And that's why transplant patients should wear masks almost any time they go out into crowded situations, so they're all pretty darn good at it. And now there's a discussion about a 3rd shot or a 4th booster shot to try and make sure transplant patients, because they do carry a high rate of mortality with COVID-19, achieve some more immunity from or protection against the COVID-19. So what we then can think is, okay, gosh, if transplant patients who are immunosuppressed because of the medications they are on to prevent them from rejecting their organs, how many patients are like that? I would argue that chemotherapy is kind of like that. I think if you have enough chronic diseases, it's kind of like that. So it should come as no surprise that not everyone is perfect, or that in terms of their response to a vaccination. But we know is the vaccines have 95% effectiveness against severe hospitalization and death. And you can still get sick with it. It's just you're going to get a lot less sick. And remember, the other reason for vaccination is that it helps protect others, because you tend not to spread the disease as much. And by having a vaccine, the virus is less likely to reproduce a lot inside of us and therefore create variants. And we're seeing a rise in now both southwestern Missouri and northwestern Missouri, where the numbers are higher. In fact, the rate of new COVID cases per capita is the highest in the country in Missouri, and it's all about those counties where people are not being vaccinated.
Right.
So the story is always the same. If you get vaccinated, you can drop your numbers, you can be safer. If you're not vaccinated, watch out. And the Delta variant is forecast now in the next several weeks to become the dominant strain in the U.S. It appears to be affecting these outbreaks in southwestern and northwestern Missouri. And the story, again, if you're not vaccinated, the variants are here, trouble's at your doorstep.
Yeah, I think my takeaway from that is just because you have underlying chronic illnesses, like it's even more of a reason that you'd want to get vaccinated and continue to protect yourself and others. And that the vaccine is something that we continue to need to promote through all of our communities. So that's my takeaway from your
totally
spiel.
Right. My long-winded spiel there. The last thing I would say is we don't want to see a third wave, but I think people are getting concerned that this is beginning of a third wave, and it's going to affect those who are not vaccinated because of the Delta variant.
Yeah.
And that's what happens in India. That's what happened in Britain, where they had to delay their opening up because of the Delta variant.
Yeah, and I think for a couple of weeks we were in the tens or below, especially in that active. I mean, I remember seeing 4 to 6 active infections in the hospital. That was all prior to Memorial Day, a couple of weeks after Memorial Day, which is about where we're at right now. So I'm just hopeful that we continue to either stay where we're at or go down, but I am a little bit worried that we're going to continue to see more.
For all the same reasons. We've opened up society, right? And we are seeing the rise of this new variant, and there's still people who are unvaccinated. And those 3 features are going to cause difficulty, and it's also not clear whether having had COVID before really protects you against the Delta variant, whereas vaccinations do work against the Delta variant. So things we all have to think about when we see the data out there, and it makes us nervous. Are there any reporter questions out there this morning? All right, I'm not hearing any, so we're going to jump into our discussion with our scouts. So welcome, everyone. Dan Reece, I want to start with you. What does it take to earn a merit badge?
Okay, what it takes to earn a merit badge is, first of all, the scout has to volunteer to, this is the merit badge that they want to do. And so there's a emergency preparedness merit badge book that they go through. There we go. And it's actually a lot of things involved in there on what to do. So this is no easy task, and it's not something you do in 5 minutes. In fact, there's quite a few steps in there. A lot of it is learning about emergency preparedness, and then also it's exploring what emergency preparedness is about, and then talking to people about it in the community on who does emergency preparedness, and then also doing. And then when you're all finished with that, then you get hold of your emergency preparedness merit badge counselor, and then that's who I am. And I ask the scout questions, and they review what they've learned from this. So an example on some of this is how to look for any types of dangers inside your house. There's a checklist that they can run through, making a family fire escape emergency plan, building a preparedness kit, also how to take someone and drag someone out of a dangerous area, how to signal a rescue aircraft, and also one of the projects is to do an emergency project or an exercise with the community, and that's where this fell in right into our lap to work out very well for the scouts.
Well, how did you all select this project around personal protective equipment? And tell us a little bit about that backstory.
So as part of Clay County Emergency Management, my boss is Melissa Evans. She's the Clay County Emergency Managing Director. And as we went into COVID operations and COVID response, we attended a lot of different meetings. So we divvied up the different meetings that we went to, and many times we doubled up with it throughout the community. And in one of the meetings, I met Carol Ayers, who later called me and asked, hey, you're in Clay County, we need some help distributing PPE in the area. And because we're very synchronized with our partners, public health in Clay County, we had an opportunity to work with Heart to Heart and a lot of other folks to sort the PPE and then also distribute it. So I went over and I contacted our troop leader and mentioned to him what he thought about it. And he said, this could be a good project, but we always stress leadership with the boys and the girls and scouts to ask them, what do you think? And he asked, and I explained the situation, that these daycare centers need this PPE and how important it was for them to protect the children, protect the people who are providing care, the daycare centers, and also their families. And when they asked the troops, is this a mission that you want to do? it was a resounding yes from all of them. So they all wanted to step forward. So they chose to do this mission, and that's how it was selected.
That sounds like a pretty cool mission. Tell us a little bit about the volume of PPE that was distributed through the project. We've heard it was a pretty good, pretty impressive number there, huh?
Right. So Dan Neal will talk more about the details on Heart to Heart, which really spearheaded this, and they are the backbone of the project for this. And I'll let Dan Neal tell part of that story. But in addition to what Heart to Heart had offered, the Ford Motor Company donated 4,500 adult masks. The Clay County Public Health Center provided 2,000 child masks. Overall, the Troop 320 from Liberty and Troop 180 from Gladstone protected over 1,900 Clay County children. They also sorted and delivered over 2,800 boxes. That includes the gallon jugs of hand sanitizer as well. And then they delivered all their PPE to protect over 332 essential workers in the child care and our child care services there. They volunteered over 346 hours between the children and the parents, the youths and the parents as well.
That's a pretty big deal. Those are pretty big numbers. Did people give you pretty good feedback around that?
Oh, I tell you, it's a testament to the scouts and the parents because Troop 320, we did this on a Saturday morning. So during the response in November and December, the troop got up early in the morning, went out there. And also, a big shout out to Winnie Terama from the Clay County Public Health Department, who also got up and had his daughter Chloe go with him to the warehouse in the morning and even in the evenings. So she accompanied him, but Winnie was the one who opened the warehouse up and was there during every distribution for that. Winnie's a good friend of mine, an emergency preparedness person with Clay County Public Health Department. So he was there as well. So was there a lot of response from the public? One of the scout parents who had dropped off some PPE had told me that when he did, he was met with tears by one of the ECEPs, the early child care educational providers, daycare centers, because it turns out she was spending her money from her salary to try to go buy PPE to keep the daycare center as clean as possible. So when he showed up with cases of wipes and gloves and hand sanitizer, he said he was met with tears there. So he told me afterwards, he said, Dan, of all the missions I've ever done in the Boy Scout, this was the one with the most impact. This is the one I'll always remember. And if you see in the background, there's a picture of a Congressman Graves. The 7th of June, we had the last PPE distribution because the demand signal was falling off. And you can see the scouts who earned their Emergency Preparedness Merit Badge. And Congressman Graves' representative was there to hand out the merit badge, and Congressman Graves was in the background, who was also an Eagle Scout as well. So it was very heartfelt. There's a picture of one of the daycare providers of Victoria's Learning Center here in Liberty, and she came all the way out there to the warehouse on the 7th to tell everybody face-to-face thank you for all the effort that they had done as well to protect her workers and also the children that they provide care for.
Very impressive. And so congratulations to Robert and Jacob. Robert, raise your hand. Who am I talking to? All right, Robert. How old are you?
Oh, I'm 13.
13. What school do you go to, Robert?
LMS.
All right. Have you been vaccinated yet?
I don't know what.
Have you had your vaccine?
Yes, I've had my first shot.
Awesome. Well done. Just checking on you. No, that's the question nobody expects, of course. I guess maybe you should expect that when you come talking to me. But anyway, so describe what you did while you were at the warehouse. I bet you got pretty good at it out there after a while.
Here, talk about.
We broke down, so we had pallets with all the items that were donated, and we broke down and sorted the items. We took like all the items that were needed for one daycare center and we put them all in like a taped down square, and we delivered each of those taped down squares to certain daycare centers that they need to go to.
That sounds pretty cool. It sounds like you had to work pretty hard. Did you sweat a little?
Yeah.
Was the warehouse pretty hot?
Not really.
Not too bad. Okay, well, good. Now, Jacob, how old are you?
I am 12 years old.
How old?
12.
12.
Years old.
All right, Jacob. Well, thanks for doing this. This is a pretty cool deal on your behalf. By the way, have you been able to be vaccinated yet?
I'm going to get it later this week.
Awesome. Well done. That's an excellent choice. Help keeping your family and this whole community safe. There should be a merit badge for vaccination. Not that I'm trying to advertise that at all out there, but it's just a thought. So, Jacob, tell me, what part of this were you doing? Were you at the warehouse as well, helping unpack those pallets, or what were you doing?
My troop was also there unpacking the pallets, and we would do what he said, and yeah, that's pretty much.
Well, that's a lot. I don't think it's pretty much. I think that's pretty much a lot. And I think you guys did a great job with that. So I understand, Jacob and Robert, that after you all did your sorting, your parents helped you with dropping off the PPE. Is that true?
Yes.
Yeah. So, Jacob, were your parents there? Did they help you with getting it all distributed once you dropped it off and stuff?
Yes, my mom and my brother, who is currently working on his Eagle.
Oh, that's pretty darn cool, keeping it in the family like that. So does that mean this was kind of a family affair as well as a scouting thing?
Yes.
Yeah, very nice. And Robert, I take it your dad may have been helping you there. Is that right?
Yeah.
Yeah. Is he a pretty good guy, or is he one of those kind of scout leaders who's like right by the book all the time? Which way is he?
It's pretty good.
Okay. Yeah.
Pretty good.
Pretty good. All right, there you go. Well, pretty good is pretty darn good. Hey, guys, do you have your merit badges with you? Let's take a look.
Yeah.
All right, looks very neat there. I like it. And I especially like the fact you all did something so cool about COVID-19 and helping us with this disease. That's really a great thing to do. And I know those people super appreciated that. Back in the early phase of this pandemic, we didn't have enough PPE. So the fact that you guys got some together and put it out there is really pretty impressive. So thank you for your efforts on that. And thanks to all the troops. By the way, how do your troops, do they like know each other? Because y'all did this kind of together.
We started off separately. The 320 did it the first time to go through the first iteration of it. Our troop's a little smaller than their troop. And then, so as we went through twice on this, I had reached out to Troop 180. We actually met through one of the merit badge counselors on physical fitness that my son had, and Troop 180 had one of their counselors that could help us out to do it. So you have to have a merit badge counselor sign off on it. They have to be qualified in that merit badge. Yeah. After talking with them, they introduced us to Becky Moberg, who was just absolute fantastic leader from the 180th. She picked up that football and ran it in for multiple touchdowns on there.
Is this the same Becky Moberg we
Becky
might know here
Moberg.
at KU by chance? I think I know who Becky Moberg is. She is pretty darn good.
Patient relations.
Yeah. Very cool. All right, so let me talk to Dan Neal for a minute. Dan, you're the operation manager up there at Heart to Heart International. Take us back to earlier in the pandemic when things were a little rocky, and especially around supplies.
Yeah, first let me say big congratulations to Jacob and Robert on your merit badge. That's just really awesome. Thanks so much for helping us and your community in this really difficult time that we've been through. Early on, there was not a lot of PPE to be found, and we began getting phone calls from fire departments and police departments and local hospitals and public health organizations, just trying to see if maybe Heart to Heart had some product that we could support the community with. And fortunately, we did have some. And we started collaborating with many organizations across the metro area to provide for PPE and hand sanitizer and other items. Thermometers was another item that was in high demand early on as well. So we've been working on this since, it was probably March of 2020. And we're still working to distribute PPE, although it's slowed down quite a bit here in the metro area anyways.
Yeah, I think the PPE thing has clearly gotten a lot better, but I bet you got a lot of great feedback from folks who got that PPE.
We really did. I mean, in addition to what Dan Reece was talking about in terms of the delivery to the early childhood education facilities, early on, throughout the whole process, those organizations were so essential to support our community because of all of the essential workers who didn't have the option to work from home and still had children that needed to be cared for. And so keeping those kids safe and those daycare centers safe was really on our top of our priority list. And many times, those daycare providers are just, maybe a mom with her own kids at home, and then she takes care of some of her neighbors' kids as well. And those are the kind of daycare providers. There's so many of them across our metro area, and many of our community, are supported by those kind of daycare providers throughout the year. And in this pandemic, they were really, really hit hard, and they really were the backbone for the essential workers to be able to let them continue to work.
That is such a big deal. And have you been able to do a little international work around PPE as well?
We sure have. Yes, we have been shipping not only here in the metro. We shipped PPE to all 50 states in 2020, and then to about 40 countries internationally as well. We're currently working on a shipment to India in partnership with UNICEF, and so hopefully that's going to go out here in just a week or so. And we have also sent teams around the world assisting with COVID-19 information. We currently have a team in the country of Papua New Guinea. They've been there for about 6 weeks, working in 3 different hospitals, supporting the staff there with training, education. Vaccine hesitancy is not just a U.S. issue, it's also around the world. And so our team has been able to encourage healthcare workers in various countries to get vaccinated, and we've seen some impact from that.
Yeah, that is such a big deal, and that you guys just do great work, and we are so appreciative. So talk to us a little bit. What do you think about this Boy Scout project and the merit badge and all that? What do you think about that, Dan?
Yeah, it's absolutely amazing. So one of Heart to Heart's core values is partnership. We do nearly everything we do through partners, whether it's a public health agency, emergency management, another nonprofit organization, or Boy Scout troops. And so this was just a real pleasure to get to work with Clay County and many other counties across the metro, and all of the volunteers and Boy Scouts that were working with them. Really, it really takes all of us, and everyone can contribute something in these kinds of disasters. And Jacob and Robert were able to find a way to plug in and provide help to their community, and I think that's just fantastic.
Yeah, that is a big deal, and I just want to say thanks to you. I want to say thanks to these scouts as well. I bet we have a few more questions coming in as we switch now to the audience participation part of this thing. Jill, what's going on out there?
Oh, we do. We have quite a few questions, but I wanted to ask first, because I'm reading questions, so sometimes I don't always listen. But Dan Reece, did you talk about the Eagle Scout and just the logistics? Because I thought that was just amazing.
Okay, yes. So we had one of the Eagle Scouts. This is part of the community support that happens as you've done so many projects. If you see the one circled there, that's Trevor. He was an 18-year-old Eagle Scout. He volunteered with the Clay County Emergency Management to help out. He imagined during a tornado, because he's majoring in logistics, supply chain management at MSU. And he came and approached the emergency management department and said, "Hey, I'd like to help out if there's anything I can do." And we said, "Absolutely, we could use a logistics chief." And we had lunch and we talked about it. And he took some FEMA classes on preparation for that. And he took a lot of independent ICS classes and NIMS classes. That's a lot of terminology used in emergency management through Northland CAPS at Liberty High School. He was working on his EMTB, so he's familiar with the incident command system. So when this kicked off, we said we need to be able to get PPE to our emergency services sector, first responders and our healthcare providers. And we knew that some of the PPE is some of the businesses private organizations may have had boxes of PPE in their warehouses or in storage. So we put together the program with Trevor, and he became the logistics chief as we stood up the Clay County Emergency Operations Center for COVID response. So at 18 years old, an Eagle Scout who became a logistics chief for county EOC, I think is impressive. He also helped us do distributed ops with that as well. So we found some PPE, and there was a picture where we went to a warehouse and we had some PPE in boxes, so we were able to get that to our healthcare providers.
That's great.
As well.
We have a couple of questions for the scouts, and then we have a couple of COVID questions. So Vicki wants to know, do any of the scouts plan a career in medicine now as a result of this project and living through a pandemic? She wants to hear from Jacob and Robert.
All right, Robert, let's start with you. Any thoughts about a career in medicine?
I personally believe it'd be great to help be a doctor and help save people. It would take a lot of work.
It does take a lot of work. I'll verify that. Nursing, physician, respiratory therapy. I think I put an ad out there yesterday about this. Social work. We need all of y'all. So plenty of work to be done, and healthcare is a great field. Jacob, how about you?
I have actually wanted to be a doctor and help people who have cancer.
Yeah, that's a great
wonderful.
field. That's a great
We
field.
do also need emergency managers in healthcare. We are always working on making sure that we're prepared for that next event, whether it's utilities related, if we lose our power, if we lose our water, if there's weather issues. Those are some of our highest risk things when it comes to emergency management in a hospital. So just something to keep in mind. You've got some experience now.
Yeah, it's a big deal. Keep it up. And I just want to say, man, back at the beginning, this PPE stuff, that was a real deal. I remember back at the first fights about how long we could use an N95 mask because we didn't have any
That's
hardly
right.
any. So.
That's absolutely right. That was something that we had to manage through, and luckily there were some guidance that we received in regards to how we could reuse N95 masks temporarily. So, yeah, absolutely something that we had to face.
And I think that's what these guys did is pretty impressive because those early childhood workers, they would have been at risk.
I'm sure they were very worried about what they were going to do, so I'm sure this was just something that really helped them out.
And Simone wants to know from Dan Neal, you said that you're still giving out PPE. Do you need supplies still, and where are you getting them?
So right now we're pretty well stocked. We are seeing that there's a lot of companies that had stocked up on PPE during the pandemic are now wanting some of their space back in their warehouses and office buildings, and so we're really pretty well stocked at the moment with the
Wonderful.
PPE that's coming in from all those various donations. But we are seeing a demand for PPE still continue in international locations. And so we're continuing to ship that product out. And if someone has access to a large quantity of supplies, feel free to contact me at Heart to Heart, and we can discuss whether or not that's something that we can benefit from.
Yeah, I bet there are some countries out there that, in reading about it, you have much more direct knowledge than I do, Dan, that really are suffering from a shortage of PPE in the height of the crisis, where it has really engulfed their country. So.
Lucy has family coming over from Chicago this weekend. All the adults are vaccinated. The kids are at summer camp. She wants to know, when they are outside, do they need to mask?
Ooh, I think if they're outside, they're pretty good.
Yeah,
What do you think,
the
Amanda?
CDC says if you're fully vaccinated, you're outside, you're with other vaccinated people, you don't need to wear a mask. Even if you're the only one vaccinated and you're around other people who are not vaccinated, you don't need to wear a mask. So.
But what about the kids if they're outside and they've been at summer camp, they've not been vaccinated? Should they wear masks even while outside, do you think?
I think outside just provides that element of safety. I mean, depending on what you're doing, but I think that we've seen that outdoor activities are much safer than those indoor activities.
As we said the other day, the shed and spread events are almost always inside close-quartered folks with unvaccinated people, and that's where we see the spread, not so much outside.
All right. Craig has plans to go to Disney World. He's been vaccinated. However, he says that they've relaxed the mask wearing at Disney World for people that are vaccinated. He has a mechanical heart valve, and he just had a bout of meningioma.
Meningitis?
No, what is it?
Meningioma.
meningioma,
Okay.
which I don't know what that is, but, and he said that was still a little bit a year ago. He just goes, am I just being foolish? Should I stay home?
Oh, that's a great question. That's a harder one to answer, and I would probably turn to your primary care physician on that one. I would say this: if you really want to get to Disney World, A, Disney World's mostly outside, so that's a good thing. Watch out for the inside part of it. But B, even though you may have been vaccinated, with your health history, I think I'd wear a mask.
Yeah, I've talked to some folks who've recently been to Disney World, and they've just had an amazing time. They could definitely see the safeguards that they've put into place in Disney World. I think wearing a mask can't harm you. So if you have any concern at all, you could continue to wear a mask whether or not it's required or not. You still have that ability to control what activities you're participating in. If there's long lines that are really congested, avoid those lines. And again, if you truly have any concerns, talk to your healthcare provider and see what their recommendation is.
And don't do a lot of stuff indoors.
Yeah,
Again, Disney
yeah.
World is meant to be an outdoor activity. Sometimes the restaurants are indoors, but even some of you can also find ones that are outside. So the more you stay outside, the safer you are. If you're uncomfortable, I'll put on a mask. Probably do okay. Talk to your primary care doc. Talk to your cardiologist. Talk to the folks who took care of your what I'm assuming was meningioma, and I think you can find a way to be safe. But don't be afraid to wear a mask.
Yeah, I think
Listen,
I'd be more concerned about how are you getting there? Are you driving? Are you flying?
Right. I still wear a mask when I go into grocery stores. It just makes me. I know. It's not. I think I was the only person in the grocery
I
store the
know
other day with a
that
mask
you
on.
become the only person.
And then I'm like, I still like it. And just to point out, I like not getting sick for the last year and a half. That was pretty darn good. And even though it's probably overkill because I have been vaccinated and I don't have something that should be suppressing my immune system like that, it makes me feel a little safer, especially when I'm around a lot of people who I don't know what their vaccination status is. And as you heard today, though they're not dying, we are getting people here who are post-vaccination who still come into the hospital. Unless you talk about somebody who's really immunosuppressed. A couple of those folks you described today, they're immunosuppressed. I mean, that's just a bigger gamble. So, man, in the uncertainty, don't be afraid to wear a mask because remember, rules of infection control travel with you wherever you go.
Okay, and Marty says
And they keep you safe.
Marty says fact or fiction. Is it dangerous for a mother who is breastfeeding to get the COVID vaccine? Rumor has it stops the mother from producing milk.
Oh,
We have talked to our
Not true.
physicians here, and they say vaccination is always safe, even when you're pregnant and if you're breastfeeding. So I would say fiction.
I would say fiction. New England Journal of Medicine article came out last week with some preliminary data looking at vaccine safety in pregnant women, and it looks great. Early data, but that's kind of what we're seeing throughout. And I know if Carrie Weinecke was here, she would say fiction.
That's right.
Take your vaccine. Plus, might even be able to send some of those antibodies through the milk and help give protection to the young child.
Isaac has a couple of questions. One of them is, are you a Boy Scout? Did you do any scouting?
Oh my gosh, you're taking me back. Okay, guys, Boy Scouts, you're just going to think I was a complete lackey. I got through first class, I think, and decided it was too hard. You guys do this hard work. And I used to go outside all the time with my family. We spent a lot of time camping and doing things I like to do. And so I wasn't a very good Boy Scout, let me put it that way. I did go to H.O. Barlow Camp a couple of years.
Cliff Irwin, who's one of our videographers, he's an Eagle Scout, and he's at scout camp right now with his son, JP.
There you go.
That's
See,
fantastic.
He's got
that's
3
good
boys,
stuff.
and he said all of them are
Are
going
all
to be
gonna
scouts,
do it.
I think.
There you go.
Yeah, he is. Okay. Isaac's other question is, it's a COVID question. This kind of takes us back to when we were in a wave here and people needed us to take some of their patients. And he wants to know, in Northwest and Southwest Missouri, are any of the patients that we're seeing transfers from those areas? Are they asking for transfers?
So I know that some of the folks, and like I said, I went through the 14 that were active yesterday. I want to say 2 or 3 of them were transferred here, and I'm not going to be able to. I want to say one was from Bourbon County, and I can't remember where the other one came from. But we do, and that's part of who we are as the University of Kansas Health System. We're going to take patients who need the advanced medical care that they can't get at their own hospital. So I don't know if it's necessarily related to them being short of beds, or really if it's we provide different medical services that these folks need. So we do continue to see transfers in from other places.
Okay, Debbie asks, Israel has seen an increase in cases of TTP, I don't know what that
I
is.
do.
Maybe you
Go
could say,
ahead. Yep.
have you seen people coming into the ER with the suspected cases? What is that?
Yeah, some people are trying to link vaccine-induced thrombotic thrombocytopenia purpura. There is a drop in platelet count. It's more predominant with some forms of vaccine than others. That's what led to the cases of thrombosis. But remember, these are 1 in a million cases. They're incredibly low. There's a background incidence that occurs in patients randomly. I mean, TTP is a known disease. ITP, the same kind of, those are known diseases. They've occurred for years and years and years and years. Far before we even had vaccination, we had ITP and TTP. There is some issue that there is a VITT, V-I-T-T. And the question is, does vaccine-induced thrombotic thrombocytopenia, which is, again, those small blood clots that drop in platelet count, what does that mean? So we know with the mRNA vaccines, there's a transient drop in platelet count. We're not really seeing a lot of it. What's more associated with the adenoviral vector-based vaccines. But again, if you stack up the odds of those cases against the odds of dying from COVID-19, it is not even close. And I think that's how we have to stand back and look at it. It's not even close. So it's much worse with COVID-19 than it is with vaccination. But I think, again, we've given the message. We've been honest all about it. We'll be happy to talk more about VIT. We can get one of our hematology guys to come back and talk about it, or ID folks. But the reality is, A, there appears to be some therapy which is fairly effective for it, and B, it's an incredibly infrequent event.
And are we seeing it in the ER?
We're not. I don't know of a lot of cases.
I haven't, of our ill COVID patients, I'm not seeing that as a condition that is they're being admitted for. So I'm not seeing it.
Let's double check with Chad Cannon, and we can ask him. He's the chair of the emergency room. We can see if we're seeing many cases of it. But I don't believe that we're seeing much because, again, it's incredibly rare. So people are trying to, I think especially some of the folks who are against vaccination are trying to blow up some of the side effects. And, what we said before, don't get caught up in the fake news stuff. And in this situation, while that is real, it is incredibly unusual and rare, and there may be some therapies for it. And if you're interested in it, if you go to the New England Journal of Medicine website, you can download a discussion about it. It's free. Anybody can download it. And the guys do a really good, the folks who are talking about it do a really good job of discussing the side effect.
Okay, Christy lives on the Missouri side. She is fully vaccinated, but she's concerned about the Delta variant. She wants to know, should she be?
Yeah, I think people should be concerned about the Delta variant. I think we're seeing the rise, and that's why I think we're seeing cases. But I think if you're fully vaccinated, you're much better protected against it. It does appear that vaccination, especially with the mRNA-based vaccines, is good with the Delta variant. And it's not more deadly, it's just more transmissible. And because it's more transmissible, it can have a higher penetration through a population, especially if you're not vaccinated. So I think if you're vaccinated, you're better off. But man, just try to get everybody vaccinated. That would be my answer.
Yeah, and I think the transmission dynamics of it, like it's still coming into your system the same way it was if it's not a variant. So if you're in a highly congested area, put your mask on or avoid going into that area. If you know you're going to be around a lot of folks, you don't know what their vaccination status is, keep your distance, wear your mask, wash your hands, cover your cough, stay away from ill people, or just kind of those basic elements of infection
remember the
prevention and
rules
control.
of infection control. They travel with you, and they
Wherever
keep
you go.
you safe wherever you go.
I have a question. Can I ask to the Boy Scouts, what is next? Is there another merit badge that is up next, or how does that work? What's your next activity? You're going to get the public health.
The Public Health Merit Badge. All
That's
right.
outstanding.
That's pretty good. Jacob, what about you? What's your next activity?
I actually just finished life-saving merit badge.
Oh,
All right.
congratulations.
Well done. Nothing. A little bit of CPR, always good for the soul.
It is.
Well, I guess the last question, we'll make it a Boy Scout question too, and that was, what has been the effect of COVID on various aspects of Boy Scouts?
Oh, that's a great question. What has it been like? Let's start with you, Robert. What's it like now with COVID-19 and Boy Scouts? Did that change a lot of stuff?
No.
Oh, you got to unmute. Don't forget to unmute. There's a merit badge for Zooming. There needs to be a new Zoom merit badge. So, Robert,
10-day Boy Scout camp was our troop didn't do it because there was a lot of like restrictions. You couldn't really do all the stuff that you would normally do. And Scouts was just kind of normal Scouts, but with everyone wearing a mask and everyone was social distancing. It was just kind of weird, I guess.
has it gotten better?
But now that it's good. It's gotten much better. We still have to wear masks and we still have to be separated, but not as far.
Well done. Jacob, how about you? How about with your troop? What was COVID, did it change things?
Yeah, they changed a lot of things, but now it's gone back to normal, or pretty much close to normal, and everybody seems like they're worried about COVID, and they're taking, like they're staying 6 feet apart for the most part so they can stay safe.
Good work. I like those answers. That's outstanding. By the way, Jacob, I'm with you about those wearing eyeglasses as a kid. I had mine beginning in the 4th grade, approximately a very long time ago.
I just got mine last week, actually.
Well, they look good. I think
good
you
deal.
rock the glasses. Well done, man. And it's nice to be able to see again, isn't it?
And we still have a lot of questions, but I know that we have a hard stop today. So, Bridget, Sarah, Sharon, Kitty, Desiree, Jean.
Well, we're here all week.
Lucy,
We're not
Vicky,
going anywhere.
We will do these questions tomorrow.
All right, there you go. And tomorrow, speaking of which, we welcome back Mayor Quentin Lucas, who joins us in the studio to update the impact of COVID-19 on Kansas City, Missouri. We'll see how vaccinations are coming and what his outlook is for the future. We'll get an update as well on his new son, Bennett, so join us. That's going to be fun. He's always a lot of fun in the studio, and we're going to have fun giving him a hard time. This is just the best. All right, so first of all, let's get to some final thoughts from everybody. Let's start. Let's start there with Robert. What's your final thought for the day?
It was nice to, I don't know, talk to everyone on this. Yeah.
All right. Hey, congratulations on that merit badge. I'm impressed. Jacob, how about you?
I thought it was great, and also thank you for letting us talk on the news.
Well, thank you for being a part of the news. That was pretty darn special. And then, Dad, how about you? You had to be pretty proud of that son and about those merit badges. Final thoughts from your standpoint?
Oh, absolutely. I'm very proud of the parents, the children, or the youth doing this. In our county, we plan on engaging with their youth a lot to see what type of support they can provide. And you'd be surprised at the thoughts of our youth and how we can do a better emergency preparedness and prepare our communities for disasters like something like this.
Well, Dan, Neal, thanks for being a part of this, and Dan Reece, thanks for being a part of this and working so darn hard with these young kids, and to our own Becky Moberg, thanks for helping out as well. And then, Dan, Neal, final thoughts from you.
I want to say thanks again to Jacob and Robert. Thanks for your example of helping your community and getting vaccinated. Thanks so much.
My final thoughts for the day, you started off this morning talking about how wonderful the weather is, so get outside. We know outdoors are safer than indoors. Get that sunscreen on, use your bug spray, and while you're out there, if you haven't been vaccinated, go ahead and go get your vaccine.
Go get your vaccine. That's always right. You know, folks, as there's concern about the Delta variant and whether you've been vaccinated, we've said it before, the rules of infection control travel with you, and they keep you safe no matter where you go. You still following them on airlines. I still follow them when I go into grocery stores. That's just me. But remember, wear a mask, wash your hands, cough into your elbow, don't go out if you're sick. Do those things to keep you safe, and mostly live long and prosper. Get that vaccination, because that's what keeps us all safe. And so, even as we conclude the day, we're going to say goodbye. Here's another look at the work done by Boy Scouts and Troops 320 and 180. We'll see you tomorrow with Quentin Lucas. Until then, there's still no place like home.